I would like to share with you my experiences in clinical practice. It is a case of 18 years old boy who was in 12th standard and studying for competitive exam. We all know 11th and 12th standard is a turning phase in students' life. All students choose their academics and seriously consider their career path. This period influences our future, our higher degrees, our professional life. And hence all students study for long hours, for 13 hours, 14 hours in a day for competitive exam. We all have been through this phase. And he was also doing the same, studying for long hours for competitive exam. He came to my clinic with chief complaints. First is headache, mostly in occipital region. And when pain becomes intense, he experienced pain in his whole head, which is aggravated by reading books, study, mental work and physical exertion, and better by pressure and tight bandaging. Next is fatigue. He gets exhausted very easily. Both physical and mental exertion causes exhaustion and fatigue, tiredness. Next is severe backache in spinal region due to long hours sitting. And last is forgetfulness. He could not remember what he read or studied in biology and chemistry. And he had a past history. Near about 2 years ago, he had a past history of recurrent boils in ears, sometimes in left or right ears, and sometimes with discharge of pus with severe pain in ears, that is otalgia. This was the case. And when I was taking his case, I observed something very peculiar about him. Even though he could not remember what he studied in biology and chemistry, he was very much interested in mathematics. He would solve tough mathematical problems with ease. We all know mathematics is an intellectual subject. It needs logic, thinking, analysis, and he was very much interested in that. He literally had a passion for solving tough mathematical problems. The normal or average students cannot do easily. Those were the kind of problems he would solve. And he would guide other students also. The tough mathematical problems that take hours to solve, he would solve them within few minutes. Isn't it peculiar? And what does it indicate? It indicates increased intellectual capacity, a capacity which is far beyond the limit of average student. He was taking efforts in the direction of intellectual achievement. He wanted to achieve something far beyond its limits. He was using his intelligence beyond his limit, and this is the crux of this case. And this is the essence of Picricum Acidum. It is very beautifully written in Soul of Remedies. What is written there? The Picricum Acidum, we see a tremendous efforts in the direction of intellectual achievement. The main delusion in Picricum Acidums are: delusion arms reach the clouds when going to sleep. Delusion's tongue seems to reach the cloud when going to sleep. Forehead seems to extend towards the clouds. And what do these delusion represents? The forehead is for thinking, the hand is for writing, and tongue is for speaking. These are the three organs of intellectual activity, and they feel stretched out to the limit, extend right up to the clouds. So the main feeling in Picricum Acidum is, I feel that my intellectual capacity and organ used to express it are stretched far beyond their limits. So I now need to rest and bring them back to the health. This is what exactly happening with this student. He was using his intellectual organs beyond his limit, beyond his intellectual capacity, and hence he was experiencing the symptoms of exhaustion. His central nervous system was completely exhausted. Picricum acidum also covers his physical symptoms. In Boerick's Materia Medica, in head section, it is written there, occipital headache relieved by bandaging tightly. Modality better by tight pressure. And Picricum acidum also covers the past history of recurrent boils. We can take the rubrics. You can see here, ear eruption boils furuncles, ear eruption meatus in boils. And the first remedy is coming, that is Picricum acidum. So the mental and physical work causes fatigue and exhaustion. This is the theme of acid. A struggle followed by collapse, exertion and exhaustion. This is the theme of acid. He was under my treatment near about 3 to 4 months. And he improved beautifully with my treatment. He did well in his academics and passed out with distinction. And his physical symptoms also improved beautifully with my treatment. So this was the case. I want to share one more experience with same patient. One day, he suddenly developed weakness, numbness and heaviness in his both legs. A kind of acute paralysis, and he could not even walk. This paralysis was developed immediately after getting wet in damp water. One day with his friends he went to see a dam, and he went inside the dam water and spent few minutes inside the water. And as soon as he came out of that dam, he suddenly developed paralysis in his both legs. But this time I did not give him Picricum acidum. Picricum acidum also covers these symptoms, acute ascending paralysis. His paralysis was acute, sudden and ascending. But the peculiarity is that it was immediately after getting wet. So I repertorized the case and I took the rubrics. And the rubrics are extremities paralysis lower limb wet after getting, extremities paralysis sudden lower limbs. And the remedy is, you can see here, the remedy is nux vomica. I gave him nux vomica 30, sometimes once in a day or twice in a day, as per the need of the patient. And he started improving gradually with nux vomica. But to speed up the recovery, I gave him 1 dose of Picricum acidum in higher potency in 1 AM. It is written in Boerick's Materia Medica in extremities section in Picricum acidum, acute ascending paralysis. Miss Picricum acidum also covers the same symptoms, but nux vomica is even better because the paralysis was immediately after getting wet, and this is very much prominent in nux vomica. So I gave him nux vomica in frequent doses, repetitively, and only 1 dose of Picricum acidum, just to speed up the recovery. Because I thought Picricum acidum was his constitutional remedy. And he improved beautifully with my treatment. Within 20 to 25 days, he fully regained his strength in his both legs. The another important thing that I want to share with you, that I have observed in my clinical practice, my observation is that Picricum acidum is a student version of kaliphos. Both remedies have marked action on central nervous system, on nerves, and both remedies cover the symptoms of nervous exhaustion. But the difference is that in Picricum acidum, you will see the efforts in the direction of intellectual achievements. He wants to achieve a task which is far beyond his intellectual limits. And in kaliphos, you will see the efforts in the direction of physical achievement. He wants to achieve a task which is far beyond his physical limits. In Picricum Acidum, intellectual sphere is prominent, and in kaliphos, physical sphere is prominent. This is the difference. I hope these experiences will help you in your practice. Thank you for listening.